Hi, and welcome to Trish Time. This year, 2017, our first guest is Judith Watson, the Executive Director for the Greenburgh Health Center, which is located on Knollwood Road. And so let's all say welcome. So welcome to the show, Judith.
Thank you.
And why don't we start off the show by you giving us a little bit of a background on how you came to the Greenburgh Health Center?
All right. So thank you again for having me on the show, Trish. It's wonderful to be here. So I've been with Greenburgh Health Center for the past 22 years, right? I'm a registered nurse by training, and in my first 6 years of employment with the health center, I worked as a nurse, and I've been the executive director now. I think this is my 16th year.
Amazing.
Whoa. The time really does fly.
It does.
So I actually came to the health center by way of a nursing agency. I was working for a home health care agency in White Plains, and they placed me there temporarily, and the rest is history.
I believe that the health center actually started in 1972. Not necessarily that you were there, but that was the beginning of the health center. Can you give us a little history on how it was established and what community it serves?
Right. So exactly, 1972 we were established, and I should note that we're a federally qualified community health center, and there are about 1,200 of us nationwide. The way that the health center here in Greenburgh was started, however, was by some local residents who needed a place to take their children for back-to-school physicals, immunizations, and in those days they'd have to take the children up to, Grasslands at that time. It's now Westchester Medical Center. So that's where they'd take the children, and they wanted something more local, something closer to home, and so it was established by some folks in the community.
And there are various services. I'm not sure that the Greenburgh community knows about this exactly. I mean, I'm sure there are some, but Greenburgh being largely a commuter town, a lot of people are in the city, they come here, they go to sleep, they eat, they go back into the city. So what are the different services that you offer to the community?
You actually bring up an excellent point, because I'm always shocked and flabbergasted with the fact that there are so many people who have no idea that we exist, in spite of being in existence since 1972. But so we provide an array of primary care services such as internal medicine, OBGYN. We deliver over 300 babies annually at our inpatient facility at White Plains Hospital. So that's Pediatrics, OBGYN, internal medicine. We have dentists. We have specialists such as ophthalmology and podiatry. We have a lab on site. We have representatives on site from the various health plans to get folks enrolled into, whatever health plans the health center accepts, and so on.
So you just talked about that you have representatives. So let's tie this into how you create awareness around the center. So you have some advocates that go out into different communities and different fairs maybe, and that's how you get the word out?
So a number of ways. Way back when, because so the health center, we're federally funded. Let me start from the beginning, right? So we're a federally funded community health center, which means that we get funding from the federal government. And there are some rules that's tied into the funding. One being that we don't turn anyone away based on ability to pay, based on residence, based on immigration status. So in fact, we were always the safety net provider in the community. And long before the Affordable Care Act, the health center was there to provide care. And again, if, for example, someone does not have health insurance because they're ineligible, because they're, say, undocumented, we charge them based on a sliding scale. We don't turn them away. But if they don't have the money to pay, we are able to work out payment plans and do all types of other things just to ensure that everyone gets served at the health center.
And so you said you do have like specialists, and besides the internal medicine and specialists, how do you determine, because this is something we'll go back to, but how do you determine what kind of specialists are at the different centers?
You know what, before we go there, it occurs to me that I didn't really answer your first question, which was regarding marketing.
Okay.
It occurred to me. So We in the past we didn't have to market. It was word of mouth. Everyone knew, right? Greenburgh was the safe haven. We don't turn anyone in because they're undocumented. So people just sort of knew by word of mouth that we were there for them. And in recent years, it's been a little bit more challenging. So as you pointed out, we do send folks out into the community to various events to sort of promote the services that are provided at the health center. And we've recently established a marketing department, right? So we have to make it official now. So we'll be doing all types of things to spread the word about the health center. So I apologize for not answering that first question.
That's fine.
And then your last question?
The next question was around the specializations that you have at the different centers. How do you determine what specialization? Because I believe at Greenburgh there's cardiology and ophthalmology, as you mentioned. So how is that determined?
Right. So the patients who are served at the health center are disproportionately affected with certain illnesses such as diabetes, high blood pressure, asthma. I know that's near and dear to your heart. Cancer and all types of other illnesses, disproportionately affected. And so we know, for example, with diabetics, foot care is going to be very important. Vision is also going to be very important. So that's how we sort of determine, because specialty services are very expensive to provide. And so, but based on the needs of our population, we said, okay, we need ophthalmology and podiatry. Cardiac illness, cardiac disease is also an issue among our patient population, hence cardiology services. And as you know, Trish, we're a division of the Mount Vernon Neighborhood Health Center, and there are lots of other specialty services that are provided on site in Mount Vernon for our patients should the need arise.
So you do have oversight over not just Greenburgh, but other centers as well. Would you like to expand on the other centers?
Sure. Thank you for asking. So Greenburgh Health Center, again, is a division of the Mount Vernon Neighborhood Health Center, right? So when you think of the infrastructure, the Mount Vernon Neighborhood Health Center is the lead, the mothership is how I refer to it, and that is where our CEO sits. And right now, our acting CEO is Opal Dunstan, who was our she's been our chief operating officer for about 21 years, and our CEO, Carol Morris, recently retired. And so Opal Dunstan now is the acting CEO. The Mount Vernon Neighborhood Health Center manages 9 sites. So there's a Mount Vernon Health Center, there's a Yonkers Health Center, and there are 4 sites up in these neck of the woods that I manage, one being the Greenburgh Health Center, and there are 2 others in White Plains, one at the Coachman Family Center, and we have a full complement of staff on site. So we have a health center on site at the Coachman Family Center, which is a homeless shelter that houses families. We also have the Women's Premier Obstetrics, which is on Lake Street, and there we do OBGYN and pediatrics. We're looking to add pediatrics. We had it at one time, and due to shortage issues, we had to get rid of it, but now we're at a point where we're able to bring pediatrics back. And the 4th site that I manage is the Grasslands Homeless Shelter, which is on the grounds of Westchester Medical Center. And that is a homeless shelter for single people. So at the Coachman, we care for the families, whereas up at Grasslands, we care for the singles.
Okay. I should be familiar with why that would be, but why would one center cater to single, homeless, and family? Is it just the space that's available, or like what's the distinction that there's 2 separate centers for those people?
So that's an excellent question, Trish. Let me clarify that we also provide homeless services on site at some of our other sites, Greenburgh, Mount Vernon, Yonkers. We do provide care to the homeless at those sites as well. But we are contracted with the Westchester County Department of Social Services to provide a component, and follow me on this, right? So upon entering into homelessness in the county of Westchester, you don't just sort of become homeless and go to a shelter, right? There's a whole process that is in place. And there is an assessment that one would need to undergo prior to being placed in one of the shelters here in the county of Westchester. And so Greenburgh Health Center provides the health component of that assessment. So there's a physical health component, there's a mental health component, and another organization provides that. There's a social component as well. So again, we provide the health component, and these are for homeless folks that are coming from all over who are looking to be placed in a shelter here in Westchester County. And so these services are centralized to the various sites, being again the Coachman and White Plains for the family and Grasslands for the single folks. So we are contracted, and we have been since the 80s, and we're happy to report that homelessness is actually down in the county of Westchester.
That was going to be our next question, so that's good, Yes.
So we're contracted with Westchester County Department of Social Services to provide those services on site for the assessment. And so continuity of services are provided at Greenburgh. So once we go through the assessment, once the families go through the assessment, then we refer them to the health center for continuity of services.
And you mentioned that homelessness is going down in Westchester overall, which is really good news, not only for the county but for people as well, that they're not being displaced. Just to go deeper into that topic just a little bit, what are the main reasons that this happens in our community?
Homelessness. So, oftentimes, unfortunately, there are substance abuse issues. There are issues of domestic violence. There are lots of fires. If you just turn on the news, you'll see. I mean, just this morning, I saw on the news that a young woman and her infant daughter lost their lives in Mount Vernon. So, fires, divorce, so other socioeconomic issues. People just cannot afford the rents, particularly in the county of Westchester, right? Yes. So you rent a place and you're doing okay, you're able to pay the bills, and then all of a sudden you lose your job and you're not able to, continue to reside there. So you enter into the homeless shelter system, and from there get back on your feet to move into more permanent home.
So I understand, too, that the Westchester Health Center, the Greenburgh Health Center, actually, you focus more on prevention rather than the cure. Obviously, you're there when, if there's a situation that needs the cure, but your focus is more on prevention. So what are the different services that you offer on that spectrum?
Okay, excellent. You have all these wonderful questions today, Trish. I don't know. Wonderful questions today. So, right, our focus is preventative care, right? And so what does that mean, right? For example, in our OBGYN department, we offer pap smears. We do pap smears. We do breast examinations, right? Early detection is the key. I know you've heard that. So if there's an issue early on, it can be dealt with sooner rather than later when it's more costly and oftentimes can also cost one their lives, right? So that's the GYN, right? So pap smears and mammograms and breast exams. On the OB end, we try to get folks to enter into prenatal care early, right? So you enter into prenatal care early, you're taken care of throughout the pregnancy, and the outcomes tend to be better, right? When you move over into pediatrics, we're administering, and again, preventative care, preventing one from becoming ill, maintaining good health rather than getting very sick, right? So in pediatrics, we're administering thousands and thousands of childhood vaccines, right? Preventing them from developing childhood, illnesses. In internal medicine, in dental, right? We're cleaning the teeth and, right? Taking care of it before it becomes a cavity, right? Preventative care. In our internal medicine department is where we care for our most chronically ill patients who come in, and many have, like I said, diabetes and high blood pressure and cardiovascular disease and cancer, and we care for them. So we try to maintain as good a health as possible for these patients.
Now, a lot of these diseases that illnesses that you've spoken about, they have to do with nutrition. So, do you have a nutrition program at the center to help people understand how their diet affects their health?
Absolutely. Yes, we do have nutrition services on site. We have a nutritionist who sees patients 3 times weekly at the health center. They meet with folks individually. They come up with individualized nutritional plans for folks. And they also have monthly sessions, monthly sessions targeting diabetes, high blood pressure, all of that stuff. And it's interesting that, and you're so right, you said it, nutrition is such an important component of maintaining good health. Yet, we have our highest no-show rate in our nutrition department. So it's something that we deal with regularly. Now, you don't know about this, but since you and I had our little meeting, we've decided to implement, well, actually, we were in the process of it. We're rolling out, it's called the Fit Kid Program. Fit Kid Program. So we do have a pediatric gym on site at the health center that we're going to be expanding, and nutrition is a huge component because childhood obesity it's just abundant among our patient population. So we're going to be enrolling the kids from 1 year up to, I believe it's 12 years, into this Fit Kid Program. They will be meeting with a nutritionist, which in addition to the nutritionist that we have on site, we also have several nutritionists who are assigned to our WIC department, because we also have a WIC program at Greenburgh Health Center on site. And so there will be individualized nutritional plans that's laid out for the kids, and an individualized exercise plan, which again includes the use of the on-site gym at the health center.
Well, yeah, that's another thing too, is, you know, a lot of times, especially in this day and age, children are so focused on technology, which means a lot of sitting down and sitting around instead of getting outside and running or doing the things that we used to do when we were children and we didn't have iPads. Not to promote that particular piece of equipment, but you know, besides diet, it's also the activity level, and especially for those who have a little more tendency to put on weight, a lot more activity is better than, again, sitting around and watching TV. Now, what is the attendance rate like, though, with regard to these nutrition programs?
Right. So as I said, our highest no-show rate is among our patients scheduled to see the nutritionist. In fact, I think our no-show rate is about 50%. It's that they have the highest no-show rate of the entire organization, because folks at dental we also have a high no-show rate in our dental department, right? Because no one wants to see the dentist. P.S. We have excellent dentists at the health center, and I always tell them it's not your fault, but no one wants to see the dentist. It's painful. No one wants to go. But with regard to the nutritionist, it's almost, I don't know that people take it as seriously as they should. And we hear about it. We get a lot of it out here in society, how important it is. But for some reason, I just don't think that it's resonating with people.
Maybe, I mean, this is just, you know, this is an opinion. Maybe when it comes down to, you know, figuring out where the dollars need to go, the last thing that they think of is food. Because there are, you know, they're not dollar stores anymore. They're like $5 stores. So they sell a lot of these inexpensive foods that are very, you know, carbohydrate and fat-based, which, as we know, that's not exactly prime nutrition that you're getting in these, you know, easy microwave meals. A lot of high sodium. So again, all of these components are tying into the heart disease and all of that. So hopefully, you know, that we have this show and we're able to speak about these issues, a lot more people will take advantage of these programs. And definitely, as I'm walking, not really walking around Greenburgh, but as I speak to people in Greenburgh, I'll definitely let them know that these services are available at your center. Now, you mentioned something about a sliding scale. So, I mean, I understand what that is, but for those that might not be so clear on that, what exactly does that mean?
Right. So there are different segments of our population who, one, they qualify for insurance. And for those folks, a lot of them come in already with insurance, but for those who qualify and don't have insurance, we have the marketing representatives on site from the various plans that can help them get enrolled. In addition, we have the Affordable Care Act. We have a team of about 5 individuals who are there solely dedicated to getting folks signed up into the Affordable Care Act, aka Obamacare, right? And then there's a segment of the population who fall into the category of not qualifying for insurance because they're undocumented, you know, and right now with this administration, we have no idea exactly what will happen, but the health centers have always been there and we will always continue to be there. But anyway, so for those who are not eligible for insurance, there's a sliding scale. And for example, in order to see one of our internists, it ranges from $20 to $60. So if someone came in, we look at the income, and that's where we assign a fee to them. If someone were to walk in and they did not want to share any information about their income, we would just charge them the $60. And many people utilize that option to pay the $60. And $20 may seem like a lot of money. It may not seem like a lot of money to a lot of people, but for many people, $20 is not easy to come by for many.
Well, precisely. I mean, tying that into what I said earlier, that a lot of people buy food. I mean, I go to the $5 stores, which used to be $1 stores, and actually I have to be careful because you think, oh, it's only this much, and you go out and you're like, oh, when you go to check out, it's actually quite a bit of money. But, there are several food aisles there. And, again, the food isn't exactly what you would call healthy. So, talking to the center and attending these programs would actually benefit the population, because that's, again, it's a greater component of healthcare. It's just, again, I suppose the money. Should I pay the rent or should I eat? I'll pay the rent. So that's an unfortunate decision that they have to make, and hopefully things will get better, and they won't have to resort to those types of food choices, because there's a lot more talk about secondary, like vegetables that are like misshapen, and how there's a program in France about that. So maybe somehow here we could implement that kind of program that allows people that don't have the resources, for people who have, $20 is a lot of money, that they'll be able to have access to better food.
And there are such programs. There are food banks, all over the county. Some of the churches I know have programs where they are able to distribute fruits and vegetables. And our nutritionists, so if anyone would like to come and sit with one of our nutritionists so that they can make them aware of the various programs that are out there, and coming up with some meal plans that are less expensive. We just have to keep putting the information out there and letting people, just stressing how important nutrition is to your overall well-being.
I think a lot of times, too, people think of nutrition and they equate it to a diet, when it's not actually. And that's how I think, at least in advertising, they're trying to change the word to lifestyle, okay, which sounds better. And again, maybe people are more open to that type of wording, because again, to some people, nutrition means diet. I have to cut back, I have to cut out, when actually it's just a matter of I have to choose better. So is there anything else about the center that you would like to talk about as we get to the end of the show?
Getting to the end, huh?
Yes.
Okay. So, I think we've touched on the fact that the health center we're here for anyone out there who is in need of quality healthcare services. Anyone who's in need, we're there to service their medical home. We're there to see them regardless of whatever challenges there are. And just hopefully you can flash our number across the screen on how to reach us at 914-989-7600. Call, schedule an appointment, and let us help you to achieve good health.
Okay, great. Thank you so much for being on the show, Judith.
Thank you so much.
And thank you, everybody, for watching another segment of Trish Time. Again, below there'll be the URL and the phone number for the Greenburgh Health Center. If you need help with your health and nutrition, make sure to come check out their website, check out the information, and give them a call, because again, this is for the community, this is for you, and hopefully you will benefit from their services. Again, thank you for being on Trish Time. This is Trish Tagley. Bye-bye.